Hello and welcome. I'm Dr. Alison Goggin with Little Black Bag Medicine, and today we are talking about taking your morning basal metabolic temperature to track your hormones throughout the month. Now, I use this for my patients for hormone tracking to understand a little bit deeper about what's going on with their body. Many women use this to achieve pregnancy as well as avoid pregnancy. For this video's purposes, I am only talking about using this situation, this fertility, or I'm only talking about using your morning temperature tracking to track your hormones. This is not a good video to learn about avoiding pregnancy or achieving pregnancy. So I take no personal responsibility if you get pregnant. So don't use this if you aren't sure. We're going to talk about this later. So in this video, we're going to talk about how to take your temperature, the rules behind this, how to track, what apps to use. I'll give you all of my resources. We're going to talk a little bit about why we're doing this, what to look for, and how really you know if you're doing it right or what we need to do. So let's talk about how to take your temperature. So the first thing is you need a basal, B-A-S-A-L, thermometer. It's also called a fertility thermometer. You find it in the women's section with tampons, pads, condoms area, wherever pregnancy tests are, at Walgreens, Walmart, Target, basically any major store is going to carry them. And it's going to usually be pink as well. You want one that you put under your tongue because it's going to be extremely specific. You cannot use a regular thermometer because it will not be specific enough to track your temperature for this. We're looking for very specific numbers, and we want it also to be very accurate because you don't want to see a shift and then have it wrong, okay? So the number one rules is that you wake up, your alarm goes off, you take your temperature. You're not allowed to get out of bed. You're not allowed to brush your teeth. You're not allowed to go to the bathroom. You're not allowed to get dressed. You're not allowed to go have breakfast. We want your resting metabolic temperature, the one where your body's slowing down all night and it's resting. You wake up, that's your temperature. So some of the reasons the reading may not count include if you sleep less than 3 hours, you probably won't have a good enough rest to induce that metabolic rate, so it won't count. If you have a fever, of course your temperature doesn't count, so still write it down, but note that if you had a fever or you weren't feeling well, or if you were drinking alcohol the night before. Now, a little bit, like a glass or two, probably won't hurt. If you went out and had an all-night bender and went to sleep, woke up, you probably won't have a accurate reading either. So keep those things in mind as you're tracking. So how do you keep track of your temperature? I will give you the link below in the comments of what websites to use. You can print off a sheet. That is the very old school method, or you can use an app on your phone. There are tons of apps that are free. Some are paid. I personally use Kindara only because I found it a few years ago. All of them will track your temperature. You can put in your symptoms. You can put in everything that you've ever needed to do. Many of them will allow you to share your chart with your provider, so you can either email it. A lot of times women will just screenshot it as well. I do recommend that you use an app or an actual physical chart instead of just writing down the numbers, because what we're looking for is a very, very small change. And the app will give you, or really even on paper, a large visual representation of what we're looking for. So it's important to write it down. Now, it is also important that you write your temperature down immediately after you take it. And the reason for this is if you go back to sleep or you go start doing something, you're going to forget. Trust me, I've been doing this for years. You're going to forget. Write it down immediately. There are some companies that sell Bluetooth thermometers, so that way you can take your temperature and it will send it directly to the app and you don't have to write anything down. So if you're someone that you know you're going to hit snooze, just take your temperature, fall asleep with the thermometer in your mouth, and it'll take care of itself, okay? So that's another option. All right, so what are we looking for? For my purposes, especially with this video, we're looking to track your hormones because we want to see what's going on throughout your cycle. I always offer saliva testing and blood testing. Most blood test is a one-off test, right? You're not going every single day to get your blood drawn. The same with saliva testing. You can do a 1-day test. They also have a 3-day test. Saliva testing also offers a month-long test where you spit in a tube every 2 to 3 days throughout your cycle, and then they measure each one. That becomes expensive. It takes a lot of time and effort, and you have to remember to do it. So it's a great test to do. I have used it on many people, but this is a great kickoff to understanding what's going on with your hormones. So in the morning, your temperature will be lower. Most women range between mid 96s to low 97s. And then after you ovulate, your temperature will rise. Now, it's not a big rise. It's usually between zero point 0.4 and 0.8 degrees. So that's why I say if you write it down, you're like, well, it's 96.5 and now it's 96 or 97.1. It doesn't look like a big jump, but when you see it on an app, you're going to see that big spike and you're going to know that something changed, okay? And then after you ovulate, your temperature remains high until your next period. So we can tell many different types of things through your temperature tracking. If your temperature is too low in the morning, we know that there's a thyroid issue going on. What day are you ovulating? Is your temperature staying high enough? Meaning, do you have enough progesterone to maintain a pregnancy or really avoid PMS type symptoms? And it's really, really helpful. So if you're looking to avoid pregnancy, this is absolutely a great technique. However, I would highly recommend reading the book Taking Charge of Your Fertility by Tony Weschler. I'll link that down below. I would take classes. I would find someone who's certified in this technique to walk you through it. I did this technique for many years. I also got pregnant twice accidentally because of the chart was misread and all kinds of things. I'll tell you a story if you ever want to hear about it. But avoiding pregnancy is a completely different game than trying to get pregnant. With this, you can track your cervical mucus, you can track where your cervix is within your body. There's many symptoms to track. Track all of them. Some techniques will tell you, oh, just track your cervical mucus, or oh, just take your temperature. If you're trying to get pregnant or avoid pregnancy, do all of them. For our purposes in functional medicine, my focus right now is let's just take your temperature and see what's going on. So you have the absolute ability to dive into this information as much as you want. Make sure that you check the links here below for Tony's book, her charts, leave you the apps, everything that you need to know, so that way you can get started and start tracking now to understand your cycle. If you have any questions, you can message me. If you're a patient, you know how to get a hold of me. If you need help, you can find me on Facebook at Little Black Bag Medicine and shoot me a message there. So thanks for tuning in, and we'll see you next time.